I wanted to just say a few words around the reasons people pursue CAEP. I know sometimes folks are required, but we also have been looking carefully at what people say after they go through as to the benefits, and I wanted to enumerate some of those. Also wanted to remind you that CAEP is an organization that is recognized by the Council for Higher Ed Accreditation, and we have been since our formation in 2013. And what that means is that we're also continuously looking at data and developing quality assurance mechanisms in response to the entity that recognizes us. But some of the things that folks recognize from going through is that it's an opportunity to establish and refine a quality assurance system. And I think the continuous improvement focus overall is what's most beneficial. It provides an opportunity for faculty to focus on common goals and provides data to support claims and can fend off threats from lower quality competition, which is definitely something occurring across the nation right now. It also allows comparison against national benchmarks and in some cases reciprocity, as with the state of Virginia currently, and an opportunity through the core model to learn from one another as you're going through, and certainly also an opportunity to celebrate success of accomplishments as you go through. CAEP maintains partnerships with over 30 states and a dozen specialized professional associations, and we do that to help out providers going through the process. So again, we're very pleased to have you here today, and Malina is going to talk a bit about the revision of standards, which is a process that is in our bylaws to do every 7 years to look at those. And Malina, I'll turn back to you. So thank you. Good morning.
Great. So good morning, New Jersey. I want to welcome you all to our session about the standards, and also talk a little bit briefly about something that I have a connection to New Jersey. I actually grew up in New Jersey and went to New Jersey Public Schools, so I'm a product of New Jersey Public Schools. And I put this slide in here because the teacher who is right above me on this picture, Mrs. Kay Allgaier, was my absolute favorite teacher. She was phenomenal, and part of what made her a phenomenal teacher to me as a student was that she always made me feel like my voice mattered and that I was part of the process. Even though I was 7 years old and in the first grade, she made me feel important and that my voice did matter. And so in thinking about the revision of the standards, we wanted to have that same kind of feel about the process. So we wanted to make sure that all of our stakeholders were part of the revision model, and that we were including them in all the conversations with the revisions of the model, of the standards. So we do have the board. The standards are actually board standards, and so we start and end with the board always, and they had a part in the middle as well to release the revisions that we had done for public comment. And so we had a task force and we had some board committees, and I'll talk a little bit more about each of those as we go on. So again, the focus for the revisions was to include as many diverse voices as possible and really hear from the field about their feelings about the 2013 standards and where we could make improvements or additions to the existing standards. So we had on our task force, we had CAEP volunteers. So if the reviewers, site leads, the CAEP board, and accreditation council, so we had representation from all of those groups. On our task force, we had EPP representation. We focused on over-representing a little bit of the spring 2022 EPPs because they were the ones that were going to be implementing the revisions, and so we wanted to make sure they were aware and part of that conversation. And then we had state partnerships, so we had state members participate on the task force as well, and we had 4 states represented on our task force, and we wanted to ensure that we were meeting state requirements of our partnership agreements with our states, and that we're not changing anything that was required within those partnerships. So we wanted their voice there. And then I think a really key element to our task force was that we had current practicing P12 teachers on that task force, and they also had other roles. So not only being a current teacher, but also being on our accreditation council or being a reviewer. So many of our reviewers are P12 teachers. And so they give us an interesting perspective of the process from their end. So we wanted to make sure that we included those. We had 3 practicing teachers on our task force as well. Then we had representation from external groups. So we had teachers unions and the Southern Regional Education Board. We had a family and community engagement group. We had a community college representative. So lots of external groups as well. The revisions work that we did in the task force went out for public comment. So for 45 days, it was out for public comment, and we had many comments from parents, educators, and just the general public. And so that was very nice as well. So our charge for the task force was not to come up with new standards. That was not our intent, and that was not our charge. Our charge was to review data and evidence from board committees. We have 2 research and equity and diversity, so 2 standing board committees that did some work on reviewing the 200 or so cases that had gone through CAEP accreditation and really looking at the data, what EPPs were providing in terms of evidence, and really mining that data and looking at the implementation data and writing reports. So each of those committees wrote a report about their findings and recommendations for the task force. We also have to meet GIA guidelines, and so we have to make sure we are meeting our accreditors' requirements. So we didn't want to make any changes that would endanger that. And we are also seeking U.S. Department of Education recognition, and so we wanted to make sure that all of the requirements for U.S. Department of Ed were also incorporated in this round of revisions, so we wouldn't have to go back and do that again. The Accreditation Council actually feeds quite a bit of data back to us on decisions, and so we look across EPPs, we look across components and standards, we look at AFIs and stipulations and where they're pooling, and if there's issues with training or other things that we can improve, we use that data as a continuous improvement piece for us. But there was a lot of data, so we had a lot of accreditation decision data to look through as well. And then we had field comments. So for most of you, if you've been through a CAEP visit, you've made comments back to CAEP about the process or ways to improve or things that you thought went really well. And so we had collected all of those in format that the task force could look at. So we had all of that information to start our process. And really, we were looking for some key elements. We were looking where there was overlap and redundancy within the components and standards. So we wanted to make sure that we were trying to consolidate as much as possible. And part of that came from the implementation data, where EPPs were tagging and referring to the same data multiple times. And that because there was some repetition within the components or standards. And so we were looking to see if there was ways to consolidate. We did quite a bit of consolidating as we went through the process. And then we were really looking for clarity of language. That was a really critical piece. So we were looking to make sure that the expectations were clear, the wording was clear about those expectations, and that that implementation data really helped us with that as well. Our reviewers and the Accreditation Council, who also review cases, were instrumental in helping us find where there were places where we maybe have been over prescriptive or that there were some vagueness that needed to be clarified. So we spent a lot of time with working with clarity of language. And then, of course, we updated language. The original standards were done in 2012 and 2013. And so we wanted to make sure we updated any language as needed. So the sort of 50,000 foot view is, and I put this slide in here just to kind of give a quick overview of where we did do some consolidation. So where you see there's consolidation of components, the first number is the revised standards and the second number is the 2013 standards. So in standard 1, we went from 5 components down to 4. And we spent a lot of time clarifying language in standard 1. So I did put an asterisk there. We reorganized and rethought the best way to approach standard 1, and I'm going to show you what we wound up doing. And then standard 2, a clarification of language. We did add modality to 2.3, which is about clinical experiences, and really helping candidates to have some experience with something besides face-to-face. So hybrid or online instruction, because as we know, the pandemic has really forced teachers to move into a different modality. And so having some experience within clinical experiences for candidates was sort of an important and timely addition to the provisions. Standard 3, we reconceptualized 3.2, and I will show you that as well. Also consolidated quite a bit there. There was a lot of overlap within Standard 1 and within Standard 3 components, and so we really worked to consolidate there. Standard 4, we did some flexibility for the old 4.1 and consolidated as well. Standard 5, which all of you know is my favorite standard, we didn't do a whole lot of content change. We just reordered some of the components and did a little bit of consolidation. I think one of the biggest changes that came out of the board committee for equity and diversity was that they really wanted to see the cross-cutting themes of technology and diversity be embedded back into components. And this really, I think, was a large part of our work last summer in really thinking about ways that we could do that to emphasize and highlight those areas more, and also to make the expectations for EPPs and reviewers clear regarding those two crosscuts. So the cross-cutting themes went away as crosscuts, but those ideas were embedded into the components and actually have, I think, a more prominent role within the components and standards than they did as a crosscut. So that was, I think, one of the biggest changes that we saw with the revision process. So again, we sought feedback and public comment as part of our model. So we had 3 pre-vetted groups that we really worked with to gather some information. We did the spring 2022 EPPs, our state partners, and our volunteer pool. So those were 3 groups that we did a little more in-depth work with, and to do our validity models, and also to discuss some of the changes in the pre-vetting format. And then we had lots of external groups that gave us feedback as a group. So not individual feedback, but feedback as a group. So we had deans groups, we had several associations, we had the Family and Community Engagement Group, AACTE, Branch Ed, etc. So lots of those groups did one sort of set of comments for the revisions. And we had over 200 individual comments from public comment during that open phase. So I did list all of the standards in here just to have it in the PowerPoint for you, and we can certainly reference back if we need to during Q&A. But I wanted you to see sort of some of the highlights for each of the standards. So in Standard 1, I think we did a lot of key work with clarifying the components and making sure that they were clear. A lot of these elements were all in 1.1. So 1.1 in 2013 standards was really big, and it had a lot of elements. And I think there was a lot that was unclear, I think, to EPPs on what to address in old 1.1. So really thinking about these bigger buckets and making those the components was a key element to the revisions. Also, the explicit reference to the INTAS standards. So instead of just the 4 main sort of categories of INTAS, we really want the folks to think about the 10 INTAS standards and where they would be appropriate. And so we made sure that they were embedded within the text of the components. And again, that's a clarity for the writer of the self-study, but also for reviewers and for the Accreditation Council. Equity, diversity, and inclusion is highlighted in Standard 1. It's in the actual standard, and it's also in the requirements for the components in terms of working with diverse populations and students and their families. In instructional practice, we did have an explicit mention of technology standards, and that was an important addition. So either state approved technology standards or nationally recognized technology standards such as ISTE are part of R 1.3. And so that is something that you're really thinking about embedding those standards and elements within the work in clinical practice and coursework. So that was something that had been there, but we wanted to make sure that it was kind of raised up and clarified about the expectations. In Standard 2, we did some clarification with wording, but not a lot of other work. And then we added the utilizing various modalities in R 2.3. So that was, I think, the biggest change, and that the rest of those components basically stayed the same. So we didn't make a whole lot of revisions there. Standard 3 looks a lot different, and we went from 6 to 3 components, and this is an important distinction in that R 3.2 about monitoring and supporting candidate progressions does not include any test score requirements. So there are no more test score requirements in 3.2. And the GPA, cohort GPA of 3.0 is still there, and we left it in R 3.2 because it is measured at any point in the program, and it's usually aligned to a gateway, and so, or transition point. And so that made sense that it would stay with the monitoring and supporting of candidates piece. There are some clarifications in R 3.2 about the disaggregating of data and making sure that you're disaggregating your data and looking at your groups that you are recruiting. So going back to 3.1 and really emphasizing the fact that if you are recruiting candidates, that you're supporting them to be successful at completion. And so, you know, if you're recruiting folks in for certain groups, and then they are the ones that are struggling through transition points, what are you doing to support those candidates for successful outcomes? So that is a sort of a big piece of 3.2 that it has been, again, brought up and clarified in the text. And then R 3.3 is really about completion, competency at completion. And so the task force in the field, I think, really went back and forth about what we wanted to do with R.3, and we had many discussions about an authentic measure, a better, more authentic measure of candidate competency at completion. And so R 3.3 is a new component that really relates to that. So, you know, as an EPP, thinking about at your completion gateway, what are those elements and measures that you would like to reference and talk about that you're looking for in terms of completer, in terms of your competency of your candidates at completion of their program. So usually these are measures in student teaching or in methods, but it's up to the EPP to decide what those measures are and what the threshold is for success. So again, some flexibility with how EPPs are doing that, but again, I think a more authentic way of measuring competency at completion. So those are the measures of standard 3, and we think they're much clearer than the previous iteration. And then standard 4, we did not change the satisfaction of employers or satisfaction of completers. So those two stay the same for R 4.2 and 4.3. And then R 4.1, we did clarify and try and provide some guidance for EPPs about completer effectiveness. And so again, if you have state data, that's great. Many states do not provide any data at all. And so thinking about, you know, some examples of how you can think about completer effectiveness and how you can document that. But again, a little more flexibility there with that process. In the workbook, the resource that goes with the revised standards, there is examples of each of these two categories. And so hopefully when you look through the workbook, you'll be able to see yourself and be able to, you know, say that there are some things that you are already measuring or doing for each of these two categories that you could include in your self-study. And then standard 5, we did not change a whole lot, but we did reorganize the components a little bit. And so the numbers did change for the revised components. So we still have a quality assurance system. From that quality assurance system, you're gathering data. That data quality or the characteristics of that data is 5.2. You're going to share that great data with your stakeholders and get their feedback. That's 5.3. And then you're going to make continuous improvement decisions and document those decisions. That's 5.4. So this particular standard does have sort of a flow and timeline aspect to it. And so we wanted to make sure that was clear and it was intentional from the task force to do that. So some general questions that come up about the revised standards. One is that the revised standards for initial programs go into effect for spring 2022 visits. And so if you are a spring 2022 visit, you've been contacted multiple times, and we've done many webinars about the revised standards and provided support and resources. We do have a workbook that accompanies the revised standards, and it's a different term. So we've always had handbooks. and we make sure that the handbooks go with the 2013 standards and the workbook goes with the 2022 standards, which are the provisions. So we're intentionally using some different terminology so we're not confused about which resources to use for which set of standards. And there are transition plans within the that resource to help EPPs pivot a little bit for the revisions. So you know, I know we can't move a boat quickly, so we have to be able to pivot, and so we provided those transition plan options for some of the components in the revisions, so EPPs can pivot from what they're currently doing to the revised standards. And then the advanced standards, we did do a revision process for them as well. They were about a semester behind the initials, and most of the changes and revisions to the advanced standards relate to alignment with the initial revisions. And so we wanted to make sure, again, that the components were in alignment and where there was some commonality that we were using the same language. So there has not been a substantial change to the advanced standards. We just wanted to, again, align them and make them in line with what we did with the initial programs. And they will be approved, hopefully, with the board meeting in June. So we will hopefully not have a lot of edits to what was out for public comment, and the board will approve those in June. All of your self-study templates from spring 22 on are all up to date and have the new revisions incorporated. So you will see that when your shell's open. And then we've been doing quite a bit of webinar workshop work with folks in different groups. I'm meeting with each cohort. So every semester, so if you're going through in fall 21, we'll be meeting with you actually tomorrow to talk about logistics and support, and to also have you meet your peers that are going through in the same semester. And so we will have those meetings every semester with the cohorts, starting with when the shell opens. So 18 months prior to the visit, we'll start meeting regularly and discussing any issues, logistics, or questions that each group has. And then we have state clinic meetings. We've been meeting with our state partners about every 6 weeks. And then we have state EPP joint meetings. So like if New Jersey were to ask me to come do a presentation for deans or for others, I'm happy to do that. And all of these are free. So there's not an additional charge that we are passing on. We are doing those as a support for the field. So. And then I did want to sort of transition just a little bit because, you know, I want to make sure that the field knows that CAEP does walk the walk. And so I put the slide in here because a lot of people say, well, show me what you do that relates to the standards at CAEP, and how are you approaching your work, your daily work, and in conjunction with the standards. And so I mentioned earlier that Standard 5 is my favorite standard. And so for us, we implement lots of pieces of Standard 5 in our own daily work. And so I wanted to give you just some examples of kind of how we do that. So for our quality assurance system, we have processes and protocols in place for how training works for reviewers, how the AC works, the Accreditation Council. And so this is for those of you that know me, I love a graphic. And so this may seem a little complex, but if you start with the site visit review process, so when you complete your site visit and all of your reporting, your site visit reports and your formative reports and kind of all of that that process, I look at all the cases before it goes to AC, and I do a calibration document that basically looks across all of the EPPs and organizes AFIs and stipulations so the Accreditation Council may look across EPPs, but within standards and components, which is really important. The accreditation process, council process itself, has multiple panels that review cases. And so, you know, you have a site visit team, you have CAEP staff edits, you have the Accreditation Council panels, you have, you know, all of that information and groups reviews cases as they go through for consistency. And then we also have all of that information flows back to me for training. So when I train reviewers, when I train accreditation counselors, when we talk to the field, all of that information sort of flows into my processes for training and development of the process moving forward. So that comes back to the beginning, to the site the site visits. So we do spend quite a bit of time looking at data, and again, having multiple sets of eyes looking at all of that, and that relates to our internal processes when we can make improvements, and also all of our training. So in terms of our data quality, you know, all of our decisions at CAEP are based on research or evidence-based decisions. So we don't make decisions unless we can have supporting documentation or evidence to support those decisions as we move forward. And so, you know, we use sound quantitative and qualitative research methodology to think through how we want to approach any changes in process or data that's coming from the field, you know, how we want to put that in context of the research base. So our data analysis and reporting, again, we collect a lot of data at a lot of different points at CAEP, and we are consistent in how we are measuring and reporting that not only to the board, but to the field as well. We try and have multiple measures and triangulate our data. So again, you know, all of our data, we don't want to just make decisions off of one or two instances, but really collecting lots of perspectives and trying to figure out the best way to triangulate that data. We do internal consistency measures on our metrics, and so that is really critical for us to be looking at that. When we did the revision process, I was very concerned about, we did a LOSHI analysis for our pre-vetted groups. So looking at the validity issues, doing what we're asking EPPs to do, we were doing that at CAEP. And then also consistency measures. So where we have ratings or evaluations, making sure that we are providing consistency measures for those as well. And then again, making sure our data analysis and reporting are all actionable, relevant, and cumulative. So we have some trend data, and we're actually making decisions about the data that we collect. Stakeholder involvement, the whole title of this paper presentation was about stakeholder involvement model for the revisions, and that is something that we are doing in all of our groups. So this particular task force for the revisions was stakeholder heavy, and our committee, our committees, board committees are representative of our stakeholders, our board, our accreditation council, our reviewers. So we are very interested in our reviewer of our stakeholder input, internal and external, about our process. And so utilizing that in order to make decisions and trying to be as transparent as possible, putting things out for public comment, getting as much feedback as possible through the process. And then continuous improvement. So there are things that come up that we collect data on, we analyze, we talk about, and then we make decisions. Part of that is important for moving the field and moving us. So one of the examples is better training of site evaluators and AC members. So, you know, we looked at data from site evaluations and cases. At the end of every site visit, you get to evaluate your team and the lead. And so we use that evidence to improve our training. I've spoken with many EPPs about issues that may have occurred on their visits. And again, that's all data that's important to us, and we want to improve in terms of the training that we do and ensuring that we have consistent decisions. And so that is a key element for us. We do a lot of calibration and concordance tables and metrics. So again, trying to triangulate that data and provide evidence for us to make decisions for improvement. Clear and intentional support to EPPs. So that was, again, something that had come up in some of our data collection, that we needed to provide some more support and more touch points for EPPs. And so we are doing that with our cohort webinars each semester. We've updated written resources and guidance materials, really cleaned up the website so that there's all lots of previous information has been sort of moved so it's not confusing. So just doing a lot of work with intentional support for EPPs in the process. We have a case management model. So each case, each state has a manager, and that's your person of contact for presentations and questions and requests. That goes to the case manager. We meet every other week at CAEP, all the case managers, and discuss implementation issues or questions, concerns, consistency issues So all of that is discussed at least twice a month, and sometimes we meet more. And then really working on our timeliness. So timeliness of reports, setting teams, working on processes to help speed that process up, and then being responsive to the field. So I always have, for myself, a 48-hour response time metric, and I make sure that if I don't know the answer or I need to look something up, I at least let the person know that I'm doing that, so they have been heard and I can find the answer and get back with them. And so for my staff, I have that same policy. It's 48 hours. And if you haven't heard from somebody in 48 hours, you can email me or email them back. But that is the process. We want to make sure we get your questions answered quickly. And then we also have virtual visits that have happened over the past couple of semesters. And we had to come up with logistics for those and best practice, which we have done. And we are moving forward with listening to the field about how those have gone on. We've done about 120 of them so far. And there are aspects of them that have been very positive and we want to keep moving forward, and that will inform our decisions for future semesters. So again, we're very much involved in the continuous improvement process and really kind of living our 5.4 and making sure that we are continually improving not only our process and protocols, but our decision-making process and all aspects of CAEP. So I'm going to stop. I think I've hit right at my 30 minutes. I know I talk really fast, even for New Jersey. So if anybody has any questions or there are any in the chat, Chris and I are happy to respond to any of those.
Thank you, Malina. Thank you, Chris. That was perfect. I was just about to give my 2-minute warning. So I'm just moving over to the Q&A portion. Folks, feel free to drop questions in the chat, and there's also a Q&A either place. I'm looking in both places. But looking at the Q&A specifically right now, Claudine asked, what does the research about the first few years of accreditation cases indicate about the tension between diversity and inclusion in Standard 3?
Yeah, could I take that, and Malina,
sure.
You add to it, but I'll start. So Standard 3, the board has, as you heard, 2 standing committees. One is a research committee. We have researchers from all over the country on that. The other is equity diversity, and we also include a lot of folks from across the nation in that, including researchers. They mined Data 3, the first 200 cases, pretty deeply, because it's been one that's, of course, been criticized since its inception. Even though CAEP didn't have admission criteria, people saw it, the mention of standardized tests was quite threatening. So they looked deeply at that and actually found, a lot of candidates, around 40%, were getting support. If you're taking candidates below proficiency in any academic area, it's going to be important to support them academically as they're going through, and certainly that was the case. They found no evidence that standard for CAEP was keeping diverse candidates out of the teaching profession. And Hardin Coleman, who is on the research committee, independently looked at that very question and found the same kinds of things, that this is not a make or break for keeping diverse candidates out of the profession. Nonetheless, we did find a need to change it, to remove any mention of admissions or standardized tests, because too many people were interpreting it as having some sort of a dampening impact on folks applying or going into teaching. So it's now gone, as Malina said. I would also say, just as a former diagnostician and working with kids with disabilities, my training is in using a battery of assessments, and all of them come with limitations, but they all gave me additional information that I needed in order to intervene on behalf of a population. And standardized tools will always have limitations. The way, CAEP approaches evidence, and Malina can talk a lot more about this, is by triangulating from several sources, information and data. So even with our volunteers, how do we make a claim to you that we have well-trained volunteers? Well, we look at, survey data from what their teammates say. We look at what providers tell us about our volunteers. We look at what the lead says about volunteers. We assess the volunteers. We train them. We evaluate the training that they're given. And we look at their scores on completion. So we look at a lot of different sources of information in trying to determine what's real and what's not. Malina, what else would you say about Standard 3?
Yeah, I think for a lot of EPPs, they did use it. They were thinking about it as a sort of a barrier instead of as one of many data points. And so I definitely think that was seen, and the field felt that they were somehow keeping people that could be good teachers out of the profession. And so I think with the revision of the standards, we were really clear in our 3.2 that you are disaggregating your data, and you are looking at who you are recruiting and who is in your pool, and how are you supporting all of those different groups. So actually, I think we've actually strengthened some of the processes in 3.2 to help support any candidate that's not quite meeting expectations, and how you get them to meet expectations by completion, and then documenting that at completion. And then, of course, if you can connect that to Standard 4 and talk about them being completers in the field and being successful or high quality, then you've sort of talked about that trend of how that support is really critical. And so I think will be a really nice piece of the revised standards, is seeing that connection between Standard 3 and outcomes for in-service teachers.
Yeah, and I think there's still chat going on about this, about praxis. And I think one of the things also to consider is this was never every candidate, right? It was always been a cohort with CAEP. So we weren't looking at every candidate, but rather a cohort of candidates. And still with the 3.0 GPA, it's a cohort. So we're not looking at every individual candidate that's going through, and only those that providers put forward. So yeah, again, every assessment will have limitations and bias, and it's how it's used. In the end, our Equity Diversity Committee was really concerned about the fact that the huge achievement gap for K-12 learners in the area of reading and computation in particular continues to be a tenacious issue in this country. And how do we ensure that teachers can address those learning needs in students? So as Malina said, there's more teeth in the diversity, equity, components and standards and mention of it specifically at their recommendation to try to get at that problem. Because in the end, K-12 students are being measured on standardized tests, probably will be. There's some waivers now given from the U.S. Department of Ed, but there still is a concern of how that's addressed. And of course, if there is a disproportionate gap, you're going to have fewer candidates going from K-12 into college able to address those content areas. I mean, it just is it's a cycle that is difficult to break, but has to be addressed somehow. And the chat's going faster than I can read it. I'm sorry, Ashley. Maybe you can help with that. So.
You're muted, Ashley. I can't hear you.
Sorry about that. So let me piece that together for you. So Claudine stated, and I think you had read the initial comment. So as you know,
I did, yeah, I got that.
Core, really asking you, neither research team found any evidence like this in their work. So really focusing on what your research team found. And Claudine followed up with, yeah. So how will EPPs in states like New Jersey, who have documented inequities, now meet the elevated D&I expectation in 3, when the state has not done what CAEP has done with Praxis Core?
Yeah, I mean, something to address with the state. However, I don't think you're going to see an influx of diverse candidates. If you look at the reasons why diverse candidates aren't going into teaching, it's not because of CAEP Standard 3. So it's deeper than that. And that's what Hardin, Coleman, and a number of researchers have found as to teaching being a desirable profession in the first place, right? We've watched trends since for the last 5-10 years of decreased number of candidates going into teaching. And it's driven by a lot of things, including, a lot of professions are trying to attract diverse candidates into their professions in college. So there are choices. It's tied to pay. It's tied to the perception also of teaching in general and low retention. So, the goal of trying to make sure that teachers and administrators are going into those jobs well prepared is a good one and will help with retention overall. But it's certainly, a number of states adopt CAEP standards whole cloth and have done so and trust CAEP to do the work of accountability for them. And so maybe the standards will influence what states are doing. I mean, we hope so. We certainly communicate with states very frequently and talk with them about what's going on. And I think a threat that concerns us, we're contacted by General Assembly members across the country all the time, in response to these shortages and in response to trying to diversify the teaching force, a lot of states are rolling back standards, and some have put in shortcut prep programs. We're definitely seeing an uptick in alternative programs or direct vendor certification programs. Some of them with a couple online courses, you pay a fee and you take the praxis, and if you have a bachelor's, you can be licensed. And that's in 15 states currently. So those kinds of things should concern all of us. It's something that we talk about, think about, and work with states on as they're thinking about their requirements. Absolutely.
Thanks, Chris, for that. Any additional questions? We have about 1 more minute together.
And Claudine, you had a question about how if the state maintains these measures, and so there are licensure requirements that you can incorporate, but you can always have a higher bar, right? Because CAEP's going to have that higher bar, and then really talk to the state about what the expectations are for those test scores and what they're being used for. And I think that's a conversation. And as a group, I think all the EPPs that are CAEP accredited can, certainly come to the state and talk to them about what the requirements are, right? Because now it's not a requirement for us, and all of you are, most of the EPPs in New Jersey are all CAEP accredited. So really thinking about using us as a leverage point with the state. It doesn't work if everybody's not accredited by the same accreditor, but if they all are, then it does.
Right. Otherwise, you've got 2 standards.
Right. If you have 2 sets of standards and 2 different accreditors, then you don't have a leverage point anymore.
And thank you for engaging so much.
Yeah.
In the chat. We do appreciate it, and the conversation, absolutely. And thank you all for taking the time to sit in on our session. I hope it was helpful.